Hi, it's State Representative Jim Walsh here in my office in Olympia with another update this very busy political and public policy September. Recently, the state of Washington announced that it was joining a so-called West Coast Health Alliance with the states of Oregon and California. A little bit later, the state of Hawaii joined it. It was the governors of these states that announced the creation of this alliance, and they said that it was to assure that health care policy, public health policy in the states participating would remain science-based or based on the best available science. You may have heard these terms used before. Best available science is a term that's used a lot in public policy, law, legislative debates around matters of public health. But this issue reflects a bigger tension that exists right now between the West Coast states and the governors of each of those states and the current administration in Washington, D.C., particularly a series of reforms that the current Secretary of the U.S. Department of Health and Human Services, Robert F. Kennedy Jr., has been putting in place in his federal agency. That agency also oversees the U.S. Centers for Disease Control and Prevention, CDC. There are some controversies in the policy steps that CDC has taken in its recommendations about various public health issues, particularly around the matter of vaccines and vaccinations, where the previous administration in Washington, D.C. had encouraged a very broad approach by the CDC to encourage many kinds of vaccinations to many people in many stages of life and health conditions. The current administration, with Secretary Kennedy leading the reforms, has narrowed their recommendations. Their belief being that public health policy needs to be targeted more narrowly to specific subcategories and subpopulations of the public. The West Coast states in this new alliance feel differently. They believe that public health policy should be applied broadly to all people in all circumstances. So this is a philosophical difference in how to approach public health. The best discussions about how to implement public health policy, either in law or bureaucratic or administrative action, are to focus on the issues of policy, not bring personalities and individuals into the debate. It is unfortunate that the debate has taken on that more personal approach. I believe if we keep our discussion about public health to the science and the data of public health, we will end up with better results. And you have to be careful in considering any public health issue, because these terms, as I mentioned, best available science and other terms used like that, are very subjective. One person's idea of the best available science is not always the same as another's. One scientist's belief about the best available science does not always match another. So we have to be careful about making public policy that is too broad in the matters of public health and health care. Secretary Kennedy has not only taken a narrower approach to how he believes therapies like vaccinations and other drug therapies should be used, he has also been very active in promoting better health through diet and other practices, which is not something that the public health arena has always considered. So it's an interesting mix of both narrowing the focus of our public health debates and, in some cases, broadening them to more subject matter that isn't traditionally considered public health science and data. This is not a policy issue that will be resolved in the very near future. There are many issues around it that make it complicated, including some constitutional concerns. In the U.S. Constitution, Article 1, Section 10, prohibits states from entering into compacts or confederations that are like what this alliance purports to be. And there may be some legal action around the alliance testing its constitutionality. But the fact is, the issue of public health and how our government should promote public health and how the state government and the federal government cooperate or don't in these matters is of importance to all of us here in Washington. There'll be more to see in the months ahead, but for now, that's the state of play with our public health policy. That's it for today. Stay strong and be well.